The first thing that you do, obviously, buy a pregnancy test and take it. That's good and all, because missing your period is usually the first symptom of pregnancy. But if the test is negative, then where's your period? So there's a few different reasons why this could happen, so let's talk about that right now. But first, if you're new here, I'm Dr. Carolina Melgar. I'm a cardiologist, and I want to help you improve your health with science and common sense. So the number one reason is a possible pregnancy, but too early to be detected with an over-the-counter pregnancy test. If your pregnancy is too early, sometimes the HCG hormone is very low, and the store-bought tests can't detect it. Now, the further along you are in your pregnancy, the higher the hormone levels are. So what you can do is wait a week and then check again. Or if you're too anxious, like me, you can consult your gynecologist, and he'll order a blood test that is much more specific and can detect pregnancies very early on. Number 2 is an ectopic pregnancy. This means you have a pregnancy, but not in your uterus where it's supposed to be. It could be in the fallopian tubes or even in your abdominal cavities. Now, ectopic pregnancies don't produce as much as hormones, this HCG hormone, as a regular pregnancy. So this could show up as a negative result in a home pregnancy test. If this is the case, you can have sharp abdominal pains or pelvic pains that can come and go like very, very strong menstrual cramps. Sometimes it can come with heavy vaginal bleeding. Now remember, this is an emergency. Ectopic pregnancies can lead to severe hemorrhages. So if you miss your period and you have intense abdominal or pelvic pain, go see your doctor. Don't wait. Now, number 3 are birth control pills. They can make you miss your period. Some women end up not menstruating during the last week of their pack, where they're supposed to, and that's totally normal. It's not dangerous, and honestly, it's considered even lucky. Also, other birth control methods like the IUD can make you miss your periods. Sometimes you don't have them at all. Again, totally safe and expectable. Now, number 4 is polycystic ovarian syndrome. This can also make you skip your periods, and sometimes they can stop altogether. This happens because there's a hormone imbalance. This makes your ovaries sometimes not ovulate, so your body doesn't have the signal to have your period. Now, obviously, this condition has to be managed by a professional. Number 5, thyroid imbalance. Whether your thyroid levels are high or low, both of these conditions can cause irregular periods or none at all. Now, both of these can be easily treated and diagnosed by a professional. Number 6 on our list is perimenopause. This means you're beginning your stage of menopause and your hormone levels start to gradually decrease. You ovulate less and less until your body goes into full menopause, and that's when you're done with your period entirely. Now, usually this comes with lovely perks like hot flashes, night sweats, irritability, and insomnia. So if you think you're too soon to be in your menopause, for example, you're younger than 45 years old, but you're having all these symptoms, there's a situation called premature ovarian failure, also called early menopause. Again, a condition that is tested and treated by a professional team. Now, number 7 is high stress levels. Now, I'm not talking about those stressful days where you feel like everything is just crazier than usual. We all have those days, and that shouldn't throw off your period. But if you're having chronic stress, that can definitely create a hormone imbalance that can stop your period. For example, financial strain, losing a job, moving, a divorce, or even the loss of a loved one. This can all make your periods irregular, or they can stop them at all. Number 8, changes in your weight can also stop your periods. Now listen to me very carefully. You see, body fat is necessary for estrogen to work and generate your menstrual cycles. So if you decrease your body fat extremely, this can also stop your periods. I'm talking about extreme weight loss, malnutrition, anorexia, bulimia. And I've also seen this happen with very competitive athletes. I'm talking about, again, excessive exercise that can also lower your estrogen levels. And by the same way that I mentioned before, this can stop your menstrual cycles. So remember the symptoms and red flags that I've mentioned. Sharp abdominal or pelvic pain, excess weight loss due to extreme diets or exercise, and menopause symptoms. I strongly suggest that if you have any of these symptoms, you get that checked out by your doctor. So if you enjoyed this video and you found this information useful, go ahead and click the subscribe button. And if you have any questions, just let me know. Thank you for watching.